whoever is a medical coder, everyone knows that in medical coding we have two types of billing, physician billing and facility billing. But most of the coders don't know about the difference between physician and facility billing, as we have separate set of guidelines for both physician as well as facility billing. Hence, if you want to learn the difference between physician as well as facility billing, please watch this video until the end and also click on like button in order to provide more valuable videos like this. So, physician billing versus facility billing. Okay, so usually physician billing other name is professional billing or profi billing or profi coding. Okay, next facility billing we will call it as hospital billing. So in physician billing only physician will get the amount. Okay, in the facility billing hospital will get amount for supplies and physician services if the physician is recruited by the hospital. Whenever you want to understand physician billing versus facility billing, we need to know the core differences. Okay. For example, so our first column is physician billing. Usually we will call it as profi coding. And next we have facility billing or hospital billing. Okay. So first we need to check who is billing. So or in coding terms, you need to understand for whom you are coding. Physician or hospital or facility. What is being billed? So what are you billing or what are you coding? Professional service or resources, equipment, staff and supplies. Claim form used. Which claim form you are using? So basically based on the claim form also you can decide whether you are coding for physician coding or facility coding. So in physician coding we will use CMS 1500 form, which is a paper form, and 837P is the electronic form. For facility billing, we will use UB04, which is a paper form, and 837I for electronic format. Okay. So, what are the primary code set we will use in physician billing and facility billing? Okay. In physician billing, we will use CPT codes as well as ICD-10 diagnosis codes. As we have discussed previously, in physician billing, we will not code supplies. Okay. So in facility billing, we will use revenue codes as well as CPT and HCPCS and ICD-10 CM. Okay. Next, POS code used. In physician billing, you will use place of service, which is mandatory for physician billing. In facility billing, you will not use POS. Okay. Here you will use type of bill or TOB. Who process claims? In physician billing, Part B Medicare commercial insurance. In facility billing, Part A medicine and commercial insurance. Okay. So we will see one example related to physician billing or profi coding. So Dr. Smith bills for performing a surgery. So basically using the physician billing or profi coding, we will code for the physician service. Okay. For facility billing, the hospital bill for the OR room, nursing staff, equipment used during the surgery. Okay. So that is the difference between physician billing as well as facility billing. So and also if anyone looking for medical coding jobs in UAE, USA and India, please join in a WhatsApp group. Group link is in the description of this video. And also if anyone looking for same day surgery coding training, IPDRG training, SCC training, CCA certification training, please send WhatsApp message to 707-526-3939. So what are the key insights here? When a patient has surgery, two separate claims are generated. So one is for professional service, one is for facility. Okay. So professional service where physician will bill for his service. In facility services, we will code for facility resources. Okay. Just most importantly, you need to understand that both claims are for the same patient, same date, same procedure, but will complete differently. So because of that reason, whenever you code, you need to check the documentation, whether you are coding for physician or facility. Okay. So as we have discussed, these are the forms we will use for physician or profi coding or coding or profi coding. Okay. So this is the section 2. So these are the columns you will observe in the CMS 1500 form, which we will use for physician billing. Okay. So next we are having why POS code is critical in profi billing. Okay. So the place of service code on the CMS 1500 directly affects how much the physician gets paid. Okay. For example, if a physician performs a procedure in an office, so office POS is 11, they receive a higher payment than if they perform the same procedure in a hospital outpatient department. Okay. So this is because the facility onsets or offsets some of the physician's overhead when performed in the hospital setting. So because of that reason, you need to understand where you are coding. You are coding for physician or facility. Okay. Most common POS codes we use in profi billing are 11, which is for office, private physician office, 21 inpatient hospital, patient admitted to the hospital, 20 is for on-campus outpatient hospital, hospital-based outpatient department, 23 is for ER, hospital emergency department, so on. So 24 is for ambulatory surgery center. So where CMD surgery center, example. Okay. So these are the POS codes for profi billing. Okay. Next we have UB04 form. So which we will use for facility billing. Okay. So these are the boxes you will see in the facility billing basically. So section 4 is POS versus type of bill or TOB. As we have discussed previously, in facility billing we will not use POS. We will use only type of bill. Okay. So TOB. So basically type of bill is a 3-digit code. Okay. Found in form locator 4 of the UB04 form. So digit 1 is for type of facility. 1 is for hospital, 2 is for SNF, 3 is for home health. Next digit 2 is for type of care, bill classification, whether it is inpatient or outpatient. Next one is frequency of bill, admitted through discharge or replacement bill. So these are the 3 digits we will encounter in the type of bill. And also if anyone looking for same day surgery training, epidural training, SCC training, CCS certification training, please send WhatsApp message to 707-526-3939. So these are the common TOB code. Okay. So 111 means hospital inpatient admitted through discharge. Patient admitted and discharged. Only one bill. Okay. 131 hospital outpatient. Outpatient hospital visit or procedure. Okay. So think of in this way. So POS answers where did the doctor go? And TOB answers what kind of facility is being billing and for what kind of stay. Okay. So these are the key things you need to remember. Next we have revenue codes. The language of facility billing. As we have discussed previously, we will use revenue codes only for facility billing, not for professional billing. Okay. So revenue codes are also starts with 4 digits, which starts with 0. Okay. So these are the common revenue codes we will encounter. So 0100 to 0109. Room and board, private inpatient room charges. Okay. Mostly in outpatient setting, you will see this one. 0360 to 0369. Operating room, surgical suit changes. Okay. For example, if you see 0380, which are related to cardiovascular services. If you see place of revenue code 4502 459, which are related to emergency room, ER visit charges. Okay. If you see 04902 0499, ambulatory surgery center or ambulatory surgery center facility charges. Okay. So here we need to depend on revenue code plus CPT code is equal to complete facility line item. On a UB4, most outpatient lines require both revenue code as well as CPT code. So each and every CPT code you need to add revenue code. Okay. For example, if you see here total knee replacement or arthroplasty 0361 OR services minor plus CPT 27447 total knee replacement is equal to a complete outpatient surgical line item. Okay. So section 6, why every medical coder must know both sides. Okay. So in order to reduce the errors, while coding, you need to understand whether you are coding for professional coding or facility coding. Okay, so because of that reason, you will reduce all these errors. So section 7 is the quick reference comparison chart again for physician coding as well as facility coding. Okay, so thank you guys. So if you like this session, please click on like button and also encourage your friends to subscribe to our channel.